Hi, I'm Dr. Starsiak. In a previous video, I demonstrated BLT for the wrist, and here I'm going to show you BLT for the forearm, for the elbow, and also for the glenohumeral joint. So let's see. There, again, just like there are multiple ways to hold the wrist, there are multiple ways to make contact for addressing the ligaments in the forearm. My favorite one is really simple. It's like a handshake with one hand, just a normal handshake, and then the other hand is underneath the elbow with the thumb wrapping around in front of the proximal part of the radius, and the fingers are at the joint between the ulna and the humerus, so I can feel the medial prominence of the humerus down here at its joint with the ulna. And then in my knuckles, the olecranon is resting right there. So this allows me to, one, again balance the wrist, if that's still a component, but then also even provide translational motion at the elbow to balance any varus or valgus strains. But the big motion we're going to see in the forearm is this pronation and supination. So what we're going to do, and just make sure you relax all the way, the patient should be totally passive. The table should be at a comfortable height. Lower this down a little bit. Okay, so the table should be at a comfortable height. And the practitioner, in this case me, should be able to just relax. The assessment of the position of ease is very subtle. There's no reason to need to rush to it quickly, and since it's the position of ease, it's very easy for the body to go into it. So she's there right now. She's shifted a little bit towards pronation. There is ulnar deviation at the wrist, and as I feel for what balances the ligaments best, if I pull, well, there's more resistance to that. If I compress slightly, well, then it feels like the ligaments become more fluid, less dense and more fluid. And that's one of the most universal ways to assess balance, is that feeling of flow and ease. And then at the elbow, if I check a valgus force, where I'm pushing slightly laterally, or I'm pushing from the outside to the inside, lateral to medial with my left hand, and at the same time I'm holding the wrist end still, when I assess that valgus force versus the opposite, where I pull with the fingertips of my left hand at the elbow, well, valgus force is easier. And generally valgus is going to be easier pretty much in everybody, unless there is an injury where a varus force was applied to the elbow. So in some techniques like FPR, they say, you know, once you bring the balance and you have your compressive forces in, you only wait 3 to 5 seconds, then you bring it back to neutral. With BLT, there's not really a timetable. You just stay with it until it lets go. Sometimes it'll go further towards the dysfunction, the position of the original position of ease. So if it's the position of ease is in pronation and ulnar deviation and valgus force at the elbow, well, then frequently it will go further into that before it releases. Sometimes it'll stop, and we just stop with it and are patient and wait for it. It's important that getting into the position and the amount of force we're using, it's important that we really pay attention during that process so we don't doubt ourselves. So we are really clear that we're matching something that's there, so that when what's there starts to change, we feel it right away. And a lot of this is going to be maintained in the interosseous membrane, this membrane between the radius and the ulna. So the position of the wrist, the compression, the pronation, supination, all of that is going to help balance there, as well as what's happening at the elbow too, the valgus or varus force. There we go. had a few little instances where it's going deeper into the position, and then there's a new balance. And this is what we call unwinding, when it's gradually letting go. It feels like it's unwinding itself. And here I'm not in control, I'm not making anything happen. Ed Stiles had a really good way of putting in direct work. It's where you're giving the structure an offer it can't refuse. So that it will, pretty much, and everyone will let go. We just have to be patient and work on the body's schedule. The body really dictates how long it's going to take. We can even become aware of the cranial rhythm while we have this at balance. When we feel external rotation, that corresponds with cranial flexion. When we feel internal rotation, that's cranial extension. And we should feel that oscillation at a frequency of about 6 seconds per full cycle, 3 seconds each direction. If it's faster or slower, that's a little atypical, something may be going on. There we go. Excellent. All right. So this hold, we can get elbow and wrist and forearm at the same time. I already showed that one where it's just wrist. There's another one where we can just focus on the elbow if it's particularly problematic, if we can't get it to let go that other way. So we do have flexion and extension, and we don't need to make big changes in that. Really, we just need to find where the ease is. The ease isn't going to be on either extreme typically. So if I go to try to straighten, I hit resistance. If I flex, well, there's some ease. And so there's going to be a sweet spot in between there. And I like to keep this hand between the humerus and my rib cage. That just helps to stabilize it so they can relax their arm. And once I find balance in flexion extension, which again isn't a big positional change, it's more of a posterior pressure with the thumbs and an anterior pressure with the fingers wrapped around the back to find where do the ligaments disengage. And then we can try a valgus force, which is a force from lateral to medial, a varus force. There's not a lot to see here. I'll try to exaggerate. So valgus, varus. But with that exaggeration, you can see the motion leaves the elbow and it goes up into the shoulder. So if I'm addressing the ligaments here at the elbow, the motion is going to be subtle and hard to see on the camera. And then I can compress or I can traction. Again, compression is still what seems to work best here. And there, it's at balance. And there's a feeling of flow, which again is a little difficult to describe other than it feels like the tissues become more fluid. And then they'll start unwinding, sometimes quickly, sometimes you'll have to be still with them for a while. And you just stay with it, letting go of any agenda of wanting it to let go faster, but just paying attention to what motion is present in the body and where it's going, and stay balanced with it. It's very much like a dance. In the sense of that, maybe a little bit, it's hard to say, if the practitioner is taking the more masculine or feminine role when we talk about dancing, because generally the man leads, the woman follows. But sometimes, whereas the practitioner, we are applying a force and seeing what happens. But then sometimes we're waiting to follow what the body does. So in a sense, it's a little bit of both. But I would say it's more that we are following, if I had to choose one. once we find balance at least. But to find balance, we really have to listen. We have to follow what the body's wanting to do. There we go. A common question is, how do we know when we're done? Because generally if someone's coming for treatment, they've had a problem for a while, and we could spend more time on any one given region. So how much of a release we try to get, I think, changes over time based on experience. And it is a felt thing, it is an intuitive thing, where we don't want to just really release a wrist completely and then not have time left to address anything else. So we have to take time into account. But if there's a big problem in the ankle, well, then we might need to spend 20 minutes on the ankle, and that's the best thing we can do. So we need to use our clinical judgment. All right, so now here at the glenohumeral junction, my left hand is underneath her scapula. My right hand, I can control internal, external rotation. I can also go through flexion and extension, abduction and adduction. And you don't have to take someone through these big arcs of motion. As you pick up the structure and you're being perceptive and listening, it's pretty easy to feel the neighborhood of where the structures want to go to, and then it's just a matter of fine-tuning. So here, like, I'm fine-tuning with a little bit of external rotation, a little bit of compression, and at the scapula, I'm mostly just stabilizing. It's mostly just a sensing hand, and it's keeping the scapula from moving too much, so when I compress, it's actually creating compression between the scapula and humerus. And there, that releases out. And then afterwards, the fluidity that we feel when we find balance is present when we're not doing anything, when we're just gently holding the structure. And sometimes one thing will release, like maybe one muscle and fascia region of the rotator cuff will release, and then after we treat that, we'll notice, oh, there's something slightly different. So if time allows, and there's still something that we notice, and it's in a region that is significant given what the patient is coming in for, then we should take the time to address that too. All right, awesome. So that pretty much covers the upper extremity. Now we can use the upper extremity to treat other things in the body, like the first rib. We can use the arm as a lever, but I'm not going to address that in this lecture. So just to review, this is my favorite wrist hold. This is my favorite forearm hold, elbow hold, and then glenohumeral junction. All right, thank you very much.